So we all know that this is how we started our video games couple of decades back, and we have progressed from there to this place where now our kids are playing with virtual reality video games, and this is the technological advancements that has been taking place in this field. And this is how spine surgery, we were doing spine surgery a couple of years back, and this is how we have been transformed, and we have transformed ourselves to this place, to minimally invasive spine surgery, and now we are into keyhole spine surgeries and sutureless spine surgeries. So I am Dr. Sudhir Ganesan from Chennai, and I am going to present my paper on enhancing visualization of surgical tool through integrated motion tracking system. So this study was done in collaboration with the Biomedical Engineering Department of SSN College of Engineering, Chennai. And this is my disclosure. This was done using the SERB grant by the Government of India. So we all know with the existing latest technologies like navigation, these are the proposed disadvantages. The first one is the line of sight interruption. Because of placement of markers and the camera, there is line of sight interruption when you're operating. And you can see the attention shift. Though you're operating here, you have to look at the monitor when you're operating, and your eye-hand coordination becomes an issue in certain cases. The third and most important thing in our population is cost. We all know it is significantly costly, and most of the centers cannot afford these kind of systems. And currently this is the only FDA approved system that is available in the world for practical usage for surgeries, that is the X-Vision spine system by Augmedix, which uses augmented reality for the surgeries. And the approximate cost of a single screw, polyaxial pedicle screw in the Western countries, is about 600 USD. However, in our countries, especially in our state with government scheme, the entire package has to be finished within the 600 USD. So with this background, we aimed to create a three-dimensional augmented reality environment using HoloLens system to evaluate the HoloLens hardware with the integrated motion tracking system for visualization, and to analyze the images to track the positioning of the virtual surgical tool, and to compare the AR-based tool tracking and infrared marker-based tracking, focusing on distance metrics. See, so we used 3 spine mannequins. We acquired the CT scan images of these mannequins, and we imported to 3D slicer software for segmenting the spine region, and it was exported in the FBX format compatible with the Microsoft HoloLens 2 for further virtual projection. An augmented reality environment of the 3D model was then created using the Unity 3D software using the Vuforia engine and Microsoft Mixed Reality SDK software. And the developed AR environment was imported via the holography remote sensing application into the HoloLens 2, and Vuforia was used for marker tracking, allowing the HoloLens to detect and track markers associated with the virtual assets, and the HoloLens actually overlaid the virtual assets onto the real world view. This is how it was done. So the CT scan image of the mannequin was then projected as an augmented reality image over the mannequin, and this is the HoloLens 2 which was used, and this is me using the same. And this, we know that you can import the images of your MRI into the HoloLens, and you can zoom in, zoom out even during surgeries, and you can go and paste it anywhere in the operating environment wherever you want to place, and you can zoom in whenever you want to look at the specific segment. So this is a three-dimensional model which was created using the CT scan images, and this was placed over the mannequin just like in the OR when the patient is placed prone, and you can zoom in, zoom out, you can rotate, and you can use your hand gestures to do whatever you want, and you can use your virtual environments, and you can keep it over the model to know where you are, and you can position it accordingly. So this is the entire workflow. So we used a checkerboard concept instead of the Mira markers, and it was captured using the camera, and as I said, Vuforia and other softwares were used, and the AR environment was created, and then the images, the augmented reality images was then tracked using the software. So we used printed markers instead of IR markers, and customized scalpel tracker. We used a scalpel with a thin pointed one with a self-built 3-dimensional translation stage, and we also set up a 6x6 grid, and the marker placement was done using this, and the scalpel was moved in the 3 direction, X, Y, and the Z direction, to also know the depth perception, and the universal coordinates was recorded for 20 times until the accuracy was reached over 2 mm, and this is how it was done. And then we incorporated the same with our original instruments. So this is the 6x6 grid, and this is the tracker mesh marking system. So once you move the tip of the scalpel over the marker, the HoloLens pixel actually it captures the image image, and based on the pixel, it gives you the accurate positioning of the scalpel tip. So we compared the same with the existing infrared marker system, and you can see the cameras with the infrared markers, the Mira markers, and again the position of the tracker was compared with the same. So coming to the results, the average x-axis positional error was 0.0016, y was 0.0025, z was 0.0021, with a maximum positional error in all the three axes, it was 0.01 units. So these were the results when we compared it with the IR markers. As you can see, it was very close in the x-axis, y-axis as well as z-axis. So the AR marker based tracking system, it maintains a closer correspondence with expected measurements along the x-axis. However, in our study, we found that the IR marker tracking system actually displayed a slight discrepancy in the x-axis, whereas in the y and z-axis, both IR marker and the AR marker tracking system, they demonstrated congruence. So the proposed advantages of augmented reality is reduced setup time, improved visualization, reduced line of sight interruption, superimposition of the virtual information, and real-time interaction, improving the navigation precision. You can discuss with the HoloLens, you can give voice commands, and you can use it. This is one of the latest review papers published in 2021, and as you can see, the X-Vision system, the disadvantage is that there are very, very limited clinical results, and the papers published are from a single center and single surgeon experience. Intraoperative CT scan is required, and registration markers are unavailable for certain rigid locations like the thoracic spine or the cervical dorsal spine. And this is again another review article in 2023 which compared the costs and advantages and disadvantages between the various systems, and as you can see, it costs around $200,000, the Augmedix, which is available in the market. So what is the novelty of our study? All the existing studies in literature, it assesses the efficacy and safety of the existing technology. So our attempt is a first attempt to develop our own new technology, to integrate pre-op CT scan, to create an augmented reality environment, to explore AR using markers that can be placed anywhere, and it's the first attempt to develop a safe, efficacious and an affordable system, and the same work has been published as a chapter in the extended reality Springer textbook. So our roadmap is, we have finished the mannequin models, we are going on with cadaveric studies, we are waiting for the ethical approval, and then we'll be going on for the human trials. To conclude, AR is poised to become a dominant player, but it is still in its infancy stage. Our system enables precise marker tracking and visualization with low average errors. We are planning to extend to assess angular variation and curve distances, and we are planning to come out with our own technology. And thanks to my team, Nandri.